Let's talk about it before it becomes an issue, a real issue. Maybe somebody mentioned bronchiectasis, and I really recommend you to listen to me, because this really bothers me a lot, that many people are told to take care of their asthma and their COPD. They don't see the value of it, but I sometimes need to talk about what happens in the end stage of things, because they do happen to a lot of people. And at the bronchiectasis phase, people are willing to listen, but it's really not the phase I'm interested in capturing you. If I am meeting you there, it's unfortunate, but you still have room to learn what you need to do. My name is Dr. Mkono, and I'm going to go over this diagram over here because I need to demonstrate the importance of understanding bronchiectasis and how it can cause misery in the future, and how it relates to asthma, most importantly, because, you know, I relate to asthma a lot here, and I relate to asthma because I think it's such a simple thing for us to do with what we know how to do now. Future is different. When the cure comes, we'll talk about it. But for right now, I need you to understand that bronchiectasis is a miserable process that happens when you do not take care of your asthma. Yes. And I will show you pictures here. We're going to draw a diagram, and I'm going to begin with drawing a lung. And I want to use the analogy of a tree. The trunk piece is the big airway. And then down here, we have the smaller, medium airways. And then we go to the really, really, really small airway. And those are very important, by the way. That's where all your air is exchanging. And we get the oxygen, you know, in, and we get the CO2 out. And I'm not trying to make this, you know, ChatGPT. I'm just trying to make it easy for you to understand, because that's the whole purpose of me being here, trying to make everything so simple and hopefully grab you before you find out you have bronchiectasis and there's nothing more to do except just kind of rotate the antibiotics, steroids, and back and forth in the hospital, and you don't understand what you're doing even then, and you're still not trying to help yourself because you haven't caught on to the fact that you do need to treat that phlegm. By the way, normal lung scenario, your trunk is doing really, really good, bringing in the air all the way to those little airways. And then the little airways now, they are able to squeeze out that phlegm. If you are with asthma in the early phase, the phlegm is there because you're creating it. You should watch the other videos where I explain this process. And I do. I think very simple. And to simplify it here, I'm talking about that phlegm now accumulating over time. You're on steroids here and there. You're not taking your inhaler, so the phlegm just keeps accumulating and keeps coming back and haunting you and giving you antibiotic steroids, seeing Dr. Mkono, back and forth. And I hope you're following me. Now, you've become this chronic person with asthma. Some of you, it's true that you do have very difficult to treat asthma, but some of you are just not doing what you're supposed to. And you think you're in control, only to find out later in life you're not. And it comes to become a big bite. And I want to get you before you get the big bite, so we're talking about it. The asthma now creates the phlegm. The phlegm kind of lingers there. And you, in the beginning, are able to squeeze it from this area that I'm showing you right here. And you're bringing it up. And you're able to escalate, because that's how it works. Things kind of have little ways to creep up, and you help it with the normal anatomy. I am trying to simplify it for anybody to understand. As a matter of fact, I want to simplify it so a 5-year-old understands. And I hate to say that because most of you can go to Google and the dictionary, and you have all the resources in the world, but doesn't make the patient smarter anymore. I think it makes them worse because they're not even listening to that either. The phlegm is coming up. It's coming up. It's coming up. You get up to the top, and you can cough it up here because it's so close now. You just and you bring it out. Phlegm comes out, you feel better, you continue your life, you don't take your inhalers, you don't prevent the phlegm creation. Over the long run, everything gets destroyed. Now you have very destroyed lung. Let's move to the other side. Now, this is the lung that I really do not like to see, but it happens. I saw so many this week. I was like, you know what, I'm done. I need to talk to you guys about this bronchiectasis business because I think you don't get that either. And we need to make it simple. Because guess what? Most of you are scrolling by are the ones who are interested in listening to this. But I'll talk to the ones who've developed it because there's still things we can do about it, okay?